I would rather have HIV than a broken leg. Think to yourself for a moment how ridiculous that statement sounds. Now let me take you to a place where it may not sound so absurd. Several years ago, about 9 hours from the capital of Kampala, Uganda, towards the Congo border, we were in a dry and dusty location doing a remote clinic, several hundred patients in to the thousands who were waiting for care. About halfway in, I noticed a guy hobble over to my location. Now, I could tell from a distance that this man was in severe pain. Every time he tried to walk, his leg flopped around like a sheet in the wind. His femur, you see, had been broken. It had never healed, so every time it moved, the bone fragments touched each other and caused extreme pain. He hobbled over to my station with assistants, sat down, put down beside him his 2 homemade crutches that he had made from just broken tree limbs. He sat down and said, "Can you fix my leg?" I asked him his story. He said several years ago he had broken his leg in an accident. He had tried to seek medical care in his community. No one could provide the necessary surgery to fix his leg, and even less, no one could provide a simple cast which would have allowed it to heal relatively normally. I told him, unfortunately, we don't have a surgical team with us. I can't fix your leg. Is there anything else I can do for you? I'm going to help you with your pain. He said, "Yes. Would you mind testing me for HIV?" I said, "Of course, I'll test you for HIV. Have you been tested before?" He said, "Yes, I've been tested 6 or 7 times, all negative." I said, "Well, why would you want us to test you again?" And he said, "Because I'd rather have HIV than this broken leg." Obviously, I was shocked, so I questioned him further. I said, "Well, what's the difference?" He said, "All my friends who have HIV live a different life. They get medications for their HIV. They get job counseling, nutritional support, psychological counseling, and more importantly, they get medication and treatment for their common diseases as well." He said if he had had HIV, his broken leg would have been fixed. But as such, not so. So he was left to live constantly on the edge of starvation because he is basically unemployable. So I thought to myself, this is ridiculous. I didn't go to medical school to treat common illnesses. I came over to help stamp out HIV. You know, that's what I'm here for. I'm in Africa. This is far from home. But I thought to myself, over the next several years of remembering this patient, maybe other things are affecting people. And so now, 2 years later, having seen over 50,000 patients in Africa and Central and South America, I found myself seeing patients more like this guy. This man, at around 50 years old, had simply scratched the bottom of his leg on a limb. Here in the United States, you'd wash it with soap and water, get some triple antibiotic ointment, stick it on there, you're good to go in a few days. However, with no access to health care, this turns into a bad skin infection that eventually ate down through his skin, through his muscle, ligaments, all the way down into the bone. All this man could do was to create a homemade splint out of twigs and a dirty rag to keep the swarms of black flies from further infesting his wound. I also saw people like this boy. 15 years old, he had just had a seizure in our clinic. We questioned him further. It turns out he had had seizures every day since he was 5 years old. He had contracted a case of malaria, was unable to afford the treatment. The malaria went to the brain, causing cerebral malaria, and had seizures ever since. Here, you probably know people with seizure disorders. They take a medicine once a day, they can go to school and live a relatively normal life. Not so in the rest of the world. I also saw people like this boy. At 4 years old, he had been diagnosed with a very slight case of what's likely cerebral palsy. Here, you get occupational therapy, physical therapy, probably going to live a normal life. There, what you are seeing is this child's first ever steps. And you know what it took? 2 plastic splints and a pair of used donated shoes. I also saw people like this boy. 10 years old, he got a lung infection. He was started on an antibiotic for the lung infection, developed a rash. Now here, anyone who's a mom knows you give your child an antibiotic, they develop a rash, you go on the internet, check it out, stop, call your pediatrician, they give him a new medicine, good to go. However, the medical community there confused the rash with progression of his disease, so they gave him higher and higher doses, and the skin condition became so severe that it eventually ate away his entire skin and body, and he died just 2 weeks after this. So, I thought further, what really is killing people in the country? In the world. In any given year, let's take this auditorium as an example. Is HIV killing people? Absolutely. Those of you in the first 2 rows in any given year would die of HIV. However, even more of you, your entire section over here almost, would die of simple diarrheal illnesses. Now what is this? This is something that here you get diarrhea, you go to the drugstore, you get Gatorade, take a few pills, you miss 3 days of work, you're fine. The rest of the world doesn't have access to that, and so you die of simple diarrhea. Even more people, the entire section to my right, as well as the rest of this central section, would die of an accident. This is trauma. This is something like falling off your bicycle without a helmet. The rest of the world doesn't really have airbags. There's no neurosurgeons, there's no CT scanners, so you die of simple trauma. An even larger section, almost the entire middle section, would die of a simple lung infection. Now what is this? Something like pneumonia or the flu. Here, $4, go to the doctor, you're good to go. Maybe you miss a few days of work, but that's about it. But I'm sorry to inform you that those of you who did not die of diarrhea in this section still didn't make it. You see, when your mom was pregnant with you, she called for an ambulance. And this is what came. This ambulance is never going to come. For the last 5 years, it hasn't had a working engine or a wheel. So unfortunately, you died either in childbirth or in the first several months of life. So what do we make of all this? Should we continue to treat HIV? Yes, and we should do so aggressively. However, we have to ask ourselves, how big an impact are we having when we're treating one disease so aggressively that people are willing to get that disease just to have their basic needs met? Is it possible that we could have just as big a ripple effect treating common diseases by common people? If it is your impression that you need an advanced medical degree to recognize the skin rash in that kid who took the antibiotics, or to help fix this ambulance, then you're mistaken. You are more empowered right where you sit than you ever thought you could be. So I invite you to step out of your comfort zone. Come with us or someone else to somewhere you never thought you would go. And I also want you to change your mindset, because not everything that's deadly has a spokesperson. Thank you.